Hey mama and my beautiful mamas to be. In this video, I am breaking down what pregnancy looks and feels like at 36 weeks. Coming up. Hey there and welcome back to my channel. If you happen to be new here, my name is Nicole. I'm a mama, I'm an intentional parenting coach, I'm a pediatric occupational therapist, as well as a certified lactation counselor. And this channel is geared to help make motherhood easier on you, more joy-filled, more ease-filled. So if that's something you're into, do me a favor and hit the subscribe button. All right, so let's break down 36 weeks of pregnancy. A lot has changed these past couple of weeks. At the time of recording this, I'm actually 37 and a half weeks, so this is sort of looking back. I had an eventful week around 36 weeks of pregnancy. So there were some really big changes that took place around this time that I think are worth noting and I wanna share with you guys. So around 36 weeks is when I started to notice some edema. So that is just like excess fluid, and it usually pools in your feet or your ankles, lovingly known as cankles, but I had little sausage feet, and that actually didn't happen in my first pregnancy. And I think part of it has to do with the fact that it is really hot right now. And so the heat, and then we've had a lot of movement with moving from house to house, and now I'm climbing stairs. So my body's like, whoa, what's going on? So I have little sausage feet and mini cankles, and that may start happening to you towards the last few weeks of pregnancy. And it can be really uncomfortable. It can mess with your circulation. I notice if I'm trying to kneel down or if I'm sitting on my legs, it hurts. So I can't like sit on my heels. I have to watch my positioning because the swelling is actually impacting my circulation. So a hot tip for this, if you guys are experiencing any edema, your provider have probably mentioned to you that compression socks can help with this. Granted, it's hot, so you might not want socks on, but it can absolutely help with the edema and sort of reducing that swelling. So that's something to look into. Another big change that happened around this time was like really intense pain in my pelvis. Especially I noted at nighttime, if I'd get up to go to the bathroom, weight bearing, like putting weight on my feet, it felt like my pelvis was splitting open. And baby has been head down for a couple of weeks. So if your little one has been head down, you're just gonna feel increased pressure in your pelvic bones, and they are moving further and further apart to make room for those shoulders and everything else. And so it can be really painful. So that's just something to expect once your little one makes their way into the birthing position. And on that same note, I also noted that depending on where your child is lying in said head down position, they may be leaning against a nerve. I have been having shooting pains down my legs depending on where my kiddo is anchored within my pelvis. So there's a few moves that I do to help just reposition baby, and that's usually squatting down with my legs open as wide as I can get them, and then just tilting my pelvis forward and backward, forward and backwards. And that just might give them a little bit more space to get off of your nerves, so you're not feeling like radiating or shooting pain down your legs or up your butt, because that's painful. Another big thing that's been going on is more consistent contractions. So I've been having a lot of Braxton Hicks, and sometimes they are so intense that it actually radiates up my back. So I'll feel like that back labor, right? I'd say it's more in my mid back, which is interesting. You would think it'd be in my lower back because there's a lot of pressure there, but it tends to sprawl up my back. So a lot of just sort of breathing through this and or shifting positions, getting on all fours, using your labor ball. If you have one, your big exercise ball can really help because you can move your body in so many different positions, ease some of the pain that is just intensifying in these last few weeks of pregnancy. A fun thing that happens around this time is you're just like leaking all sorts of fluids. You don't even know what they are anymore. I thought my water broke. 35 and a half weeks. I was standing, I was getting ready for this online conference. I was getting ready to go live, and there were like thousands of people waiting for this like panel that I was on. And I called 5 minutes before because all of the sudden it had to have been at least a quarter cup of liquid leave my body. Now my water never broke with Kai, so I assumed it was my water because it was a gush. So we rushed to the hospital and they do what's called a membrane test to see if your membranes had actually ruptured or not. And they do that by sticking a really long Q-tip up to your cervix. It is not necessarily the most comfortable thing, but preparation for childbirth. And it turned out my water didn't break, so I have no idea. I don't really think I peed myself, but just know it gets weird in the last few weeks. And again, this is such a different pregnancy from my first pregnancy. I didn't experience many of these symptoms with Kai, so I feel like a newbie here. So if this is your second or third pregnancy and you're like, this is new, I feel you. All of these things can just happen, and I just want to share because a lot of times people don't talk about these things and you're totally caught off guard and you're wondering whether you are alone or if this is a common thing that occurs. So some things I'm doing to help prepare me for labor and childbirth is I am trying to get back on my pregnancy tea routine. So you can, especially at this point, be doing your red raspberry leaf to help tone that uterus and get it ready for labor and delivery. I'm seeing my acupuncturist now on a weekly basis, which has been great. It really just helps me get my mind right and also tone my body in preparation for labor and delivery. So that's a huge thing that I've been enjoying. And I'm also just trying to make an effort to move my body in some fashion. I am so tired at this point and I don't have a lot of energy or endurance to do anything that is like even semi-strenuous. But again, just moving my body, whether it's walking around the block or, taking the stairs when I have the option, I try to incorporate that into my day just to keep the blood flowing, keep baby feeling different movements. That helps to really develop and anchor in the sensory system that is rapidly developing at this point, and just to keep my blood flowing and my muscles working because we've got a lot of work to do potentially to get this child out. So, all right, mamas, I hope you found this video helpful and informative. Let me know what you guys are experiencing around this time, or if you've experienced these symptoms with a previous pregnancy. I'd love to hear about your story. I look forward to seeing you guys in the next video, and thank you so much for watching. Bye.